Hi, good afternoon, everyone. Saurabh sir, if you can just confirm my voice is loud and clear.
I can hear you.
Great, thank you so much. Hi, good afternoon, everyone. My name is Swapnali, and on behalf of Microsoft and Easyrewardz, I welcome you all for this exclusive virtual webinar on redefining patient experience strategy for 2022 and beyond. First of all, thank you so much, all of you, for sparing your time today and joining us for this session. Before we start, a few basic guidelines I would like to make you people aware of. I would request all of you to please be on mute and turn off your cameras during the session. The webinar is happening on Teams platform, so your names would be visible in the attendee list and also the session would be recorded. I hope this is okay with all of you. We will be taking your questions during the Q&A session, that is towards the end of the session. Meanwhile, if you have any questions or queries, please use the hand raise option or else you can put up your questions into the chat box directly. Giving a brief description about the webinar, COVID-19 has changed the healthcare sector overnight. From patient care to juggling numerous siloed systems and meeting the demands for better communication among facilities and patients, healthcare professionals need to manage all. With the increased demand and expectations, healthcare leaders need to leverage smart technologies in order to cope up with the disruption. Today at this exclusive webinar, we will highlight how smart technology solution can help you manage the entire patient life cycle from acquisition to engagement, retention, and more, and provide an optimal experience for patients. Also, we will learn how healthcare providers can leverage Easyrewardz Healthcare CRM and offer patient-centered experiences. And for this, I would like to invite our allied speakers for the day. That would be Mr. Soumya Chatterjee, co-founder and CEO at Easyrewardz, Ms. Archana Sangam, Head of Customer Experience and CRM at Motherhood Hospitals, Ms. Bhavna, who is country leader, retail, healthcare and growth vertical at Microsoft, and Ms. Archana Gupta, Group Head, Patient Experience at CK Birla Hospitals Limited. And this elite panel would be moderated by Dr. Saurabh Lal, who is General Manager, Hospital Operations at Max Healthcare. With this, over to you, Saurabh, sir, to get started with the session.
Thank you. Thank you for that quick description and introduction to the speakers. I think, first of all, welcome to everybody on this session. And we are going to talk about something which is the talk of the town in healthcare, which is redefining patient experience strategy for 2022 and beyond. So I'm sure we will all agree that, patient experience has actually been redefined after the COVID situation struck us about 2 years back. And the entire concept of how hospitals and healthcare organizations look at patient services and patient experience is a complete different ballgame. It's like a 360-degree U-turn. So, we will continue to discuss multiple situations and multiple examples through the course of this webinar. I will jump on to Bhavna from Microsoft with my first question. So, Bhavna, this is for you. In the current disruptive times, how do you see the healthcare industry evolving? You come from a global platform, and I'm sure you have a vision and visibility way beyond what we are seeing in India as a country. So, how do you think it is going to unfold in the next 5 years?
Thanks, Saurabh. Good afternoon to everybody. From a global perspective, and I'm not just only talking from an India perspective, the last few years have transformed every single industry, and I don't think healthcare is any exception there, right? The transformation, what we have seen in the last 2 years is equal to a 10 years transformation. And this statement has been referred in multiple forums and by multiple speakers. But what we have seen the last few years coming from a technology company is that during this COVID, there are certain behavioral changes that has brought in by the patients itself, right? The virtual health. Almost 80% of the people who have used the telehealth during the COVID-19 reported a strong patient satisfaction, and over 70% of the population expect to access virtual healthcare post-pandemic as well. And I think you and me are no exceptions either when we put ourselves in that shoes, right? The second thing that we have seen is interoperability has taken a massive shift, which was the healthcare was running in different silo systems all these while. So improving remote patient engagement requires a lot of an integrated and seamless data exchange to ensure providers can access the key patient insights. Unfortunately, 90% of healthcare data providers today have data available, but not really in a structured format. So that also kind of going to be changing the entire shift in thinking and the initiatives the healthcare would be looking at. And topping up with all of these security pressures, right? Like even if healthcare organization can't currently make efficient use of their data, such volumes of data put them at an increased security risk. A healthcare data breach comes with a hefty price tag also, right? To the tune of 7.1 million on an average is what the reports talk about. So that becomes another integral part of the transformation the healthcare is looking at right now. Above all of this, what we see is that insights, whether it is patient insights or the operations insight, is going to be changing the game completely in the healthcare world going forward, which also came in as part of the COVID behavioral changes, right? With such large volumes of unstructured data, providers must actually spend an exorbitant amount of time trying to glean the insight from that data. If you look at it, up to 70% of the time providers spend analyzing the data is wasted in ingestion and unification itself. So there is no insights that we are driving out of it. So I think these are key, four key trends that we have been seeing globally, which is also kind of putting the healthcare in a very, very accelerated pedestal to kind of greater demand for data integration and management, protecting PHI and data compliance and security. Reduce clinician burnout also. I think we have all seen that happening during the pandemic as well. The healthcare workers, this huge burden on the time and bandwidth of that. And to do all of this, technology is going to play a very, very humongous role, aligning with the enterprise strategy, personalizing patient experience, provide clinical value, best quality of patient care and operational excellence. And going forward, it is all about not just only a dollar based or a money based care. People are going to expect value based care rather than cost based care, right? So these are few things, Saurabh, we have been seeing across the world, and the healthcare providers spending a lot of initiatives towards aligning this towards these global trends.
So you mentioned that there are certain behavioral changes that have happened after COVID. I would say it's a whale of a change, and I'm sure coming from Microsoft, you would be super thrilled to understand what kind of changes has happened in healthcare, because these are things which we as healthcare or hospital operations people have been struggling for years now, and that's a huge real time discovery that healthcare providers have realized, wherein the adoption of technology and the acceptance of a lot of platform based healthcare IT solutions are now part of the mainstream. Another thing that I feel has happened is that the IT revolution has finally struck healthcare. I believe that other industries went through this turmoil way before us, and we've kind of we are a little late in this revolution, and I think that is where Bhavna, people like you can kind of handhold us through that process. So thanks a lot. That was an insightful journey for the next 5 years. I've taken note of some points, and we will talk about it. So I will quickly jump over to Soumya from Easyrewardz. So Soumya, a quick one here. How are you managing to make the lasting and positive impact on patients? So you come from a more innovative space than most of us in the healthcare segment, and as IT customization, I believe that innovation is the next spoken about area in healthcare. So how do you think you're going to work around making that permanent, concrete foundation and that positive impact on patients?
Right. So So we have been working in the customer lifecycle space for about the first 5, 6 years of the organization. We started in 2011 till about 17. We were really focused on customer lifecycle, and then we started to look around and see how we expand the space. Around that time, in fact, I keep saying this to a lot of my internal employees. So around that time, there was a company in US called PillPack. Amazon acquired it to build Amazon Pharmacy. And TJ Parker, one of the CEOs, had this mission statement that what PillPack was doing was to make an incremental value difference to people who had ailments. And because when you fall ill or when you go through a process, when you land up in a hospital or you touch any kind of healthcare institution, you are in pain, right? And any little thing that you can do to minimize the pain. And what PillPack used to do was automate the pharmacy. They were e-pharmacy. They were the world's first e-pharmacy done right. And that's when Amazon acquired them. And what they were doing essentially was to do refill automation. And at that time, my father also went through his first cardiac arrest, and I saw that there was a 1 year post. Once he left the hospital, there was for about a year, he had to follow a regime of having six medicines over 3 times a day, do tests, a lot of it. And what I also realized that after, I mean, the hospital obviously took good care of him, and obviously it was a costly thing also. But after that, it was all on the patient. So now you have somebody who is quite ill, who's outside, he's come back home, and he has to follow a regime for about a year. And absolutely, there is no intervention from the hospital. And we are in the business of CRM, which is about repeat. And in fact, where it came from is, I mean, in any other space, when the first transaction happens with a business established and a customer, it's the business establishment's hook how to get the customer back. And then I saw absolutely a different story in healthcare, that when you go and get yourself treated in the hospital, after that it's the patient's response to keep going back over and over. There's absolutely nothing that the hospital does for the patient. There's no reach out. There is no, there is no call that comes from the hospital. I mean, large hospitals, and I know you're from Max, and the people from so there's absolutely no sense of a process that you do a reach out and you basically say that, okay, how are you, and you should come back to do your test, or or you take this medication. And that's where I saw an opportunity. I saw an opportunity on two things. Obviously, for opportunity for us to get in there, but opportunity also make a difference, right? And the first and the foremost thing what we thought was, it was not a very difficult problem to solve, because a lot of these chronic ailments that people suffer from, or these large operations that people suffer from, is very well structured. There's a process how you deal with it, right? I mean, there's a medical process. And Bhavna, you can correct me, anything that has a process can be automated, right? That's the first thing to automation, is to have a very well defined process. So the process was there, but it was built on human interventions. There was very little technology intervention. So that's where we started working on our patient lifecycle management platform. I mean, back in two personal events, right? Reading of TJ Parker and my father going through the same. And we first tried to scratch the surface with diagnostics. We felt that that was an easier problem to solve. So we partnered with SRL. That partnership is still running strong, where we said that let's understand chronic versus preventive, or versus reactive. I mean, and that's what these terms we learned from them. Chronic is something which is like a diabetes, right? Or a lipidemia, which is a long-term lifestyle disease, and you have to keep doing a long-term sustained tracking of it. And reactive would be, you having a flu, or you falling, ill on certain things, and you basically do a time-based intervention, and you don't do much after that. And preventive is one of those health checkups that you keep doing on a annualized quarterly month. And but each of these have a pattern. So and as Bhavna said, right, there's a lot of data that these people sit on and you collect, but you don't work on it. So we started to work with SRL and built up a very nice platform where we were doing what we call usage and retention, that reach out to people only when it matters and with what relevant messaging it matters, right? That if you have a H1BC score that is in the range of 7 to 8, so you are in early stage of becoming chronic diabetic, so you have to do your test every 30 days. And so building out from diagnostics, then we started to talk to pharmacies, because they're very closely related, because a lot of these diagnostic interventions will lead to medications, and then medications and tests, right? That's around the time we also started to think that maybe let's just start to some hospital, institutions, and see if we can start working on that. Arjuna and I have gone back a long time working with different companies and overlapping, and she joined Motherhood, and then she said that let's see if we can crack this with Motherhood. And then Arjuna, why don't you continue your journey with? I think the same question would be relevant for you to also
So before
That was
Archana pitches
fascinating.
in, I just want to compliment you about the passion that I see in your, in your endeavor, and it
Thank you.
speaks volumes about the way you and your organization are trying to pitch in. A small piece of advice that I got a decade or two before I kind of ventured into management was, and this is obviously on the lighter note. One of my ex bosses, who I'm a part of the founding team of a of a startup, and he said that there's a very funny thing that happens. We come in, and he's a guy from Harvard, so he said that we come in and say customer, and then you guys get offended. So we actually went ahead to call the CRM a PRM, because that's a patient versus customer thing
Yes.
that comes in. So anyways,
Yes,
Archana,
absolutely. So we have been very clear. We have been very clear about our messaging also here, and we basically call it a PRM, a patient relationship system, or patient life cycle system. And we basically call these more about interventions. That what interventions can happen and how we react to that intervention. Life-changing events, right?
another thing that I want to kind of emphasize, Soumya, which you very rightly pointed out, is that as healthcare professionals, and I hold myself a little guilty about it as well, is that we are very, very possessive about our data. We talk
Yes.
about data confidentiality, and we, find it very difficult to part with our data. But fortunately or unfortunately, most of us don't even use that data. The analytics
Yes.
behind those data, we keep collecting data over years and years, and then we suddenly realize that what have we done in these past years? So I think that's also where a lot of hand holding
Absolutely.
comes in from organizations like Easyrewardz. And
Yes. Yes. Absolutely.
over to you,
And and
Archana.
and I think, I mean,
Oh,
last
sorry.
line on that, I think it's a collaboration, because you would help us make sense of the data, and then we'll
Yeah.
help you make make the data actionable for you. I think it's a collaboration, because with healthcare, I think it's a very, very the domain knowledge is very critical. And
Correct.
since it's a very life related event, right? So I think that's where healthcare professionals also have to be very embraceful about the fact that they have to teach technology folks in terms of what's sensitive,
True,
how
true,
it
true.
interprets, and then we bring in. So it's a true collaboration between us putting our minds together to create something of value, right?
Yeah.
Yeah. Sorry, Archana, I cut into your
I think
time.
it'll be wrong on our part if we talk about patient experience and don't move on to Archana, who kind of heads the patient experience for CK Birla. So I will quickly pass on the patent to Archana for her 2 cents.
Okay, so apparently we have two Archanas here. You have to
Yeah,
be
we have
specific.
but Archana Sangam was he was hinting to answer.
Okay, so
Okay, so I
I'll
think
take the cue in that case, if it's okay.
yeah.
Yeah, so I just want to continue from the description of CRM and PRM that you both, Saurabh and Soumya, you both were doing, and I'm still stuck with the terminology because for motherhood, single specialty for women and childcare, specifically focusing on maternity, it's neither a customer nor a patient. We are a happy place. We are not treating them, and so I can't call them patients. And definitely calling them customers is not acceptable. So we are still trying to figure out a very happy name for them. And then we'll add the R and M part to it. Yeah. But yeah, again, talking about how technology, in fact, technology in the last 2 years hit us stronger than COVID. We happily survived the COVID period. People came to us considering single specialty, safety and all. But implementing technology at that point of time to reduce those physical interactions at the hospital was the biggest challenge for us. Single specialties, especially we in the last, who have grown just in the last 3-4 years, so were not really that much focused apart from having a strong billing system, having good schedulers to ensure that the slots and timings are maintained, some basic communications. To turn that around, including the internal stakeholders like our doctors to accept that a pregnant lady can be consulted over telephonically and or video consultations, and our customers to accept that was the biggest challenge I, as a head of customer experience, had. Right, that was the biggest role in ensuring that things fall in place. There is a mechanism, there is a process into it. So I think that was one of the big learning of technology implementation that we did. But what happened after that is a series of volcano eruptions of technology adoptions. Like once that was done, we could go to the extent of remote and ICU management. right? Where critical babies who are in NICU, mothers and parents were allowed just once or twice to come and see them, were given 24/7 access to keep on monitoring their babies, right? The doctors were looking at them all the time, even from outside. That was an experience, and that was, I mean, if people saw the parents, those new moms and new dads looking at their babies continuously, was something that thanks to the technology and that faster adoption that happened. So that's the way where single specialty definitely adopted technology. And the last point, what Soumya mentioned in terms of organizations reaching back to customer in terms of retention, we always had the thought of retention is a pregnant coming to delivery happening. But post that, right, is what the retention actually made some sense to us. The thought that unless someone conceives again, what retention? And we can't even call them in our specialty, we can't even call them to come back to us again. So this also helped us open up and make our thought, which was always there, to enhance from maternity to brand positioning into a women-oriented brand, right? So we stepped into the 16 years till the 45, 60 years, where the entire engagement through automated communications, milestone-based life stage relevance, bringing in that into their life was brought in. Entire pregnancy journey, I'm sure you all through your partners and we all have gone through, where a lot of things have come in because of the lifestyle. There are antenatal classes, there are Lama sessions, right, which were all believed to happen only in presence of an instructor physically inside a room, closed room and all. We were able to push all that into online platform and ensure that every would-be mother, along with her partner, in fact, along with her parents, is able to attend these sessions online at the comfort of their home, in the comfort of their attire, and still get monitored to what they're doing. So in the last 2 years, this is how entire technology has impacted.
Great. So, I mean, just to your point, I without taking names, will tell you that there are some organizations in healthcare, especially in the daycare space, which have started calling their patients as guests. You know, because it's neither a patient and customer is too commercial. Right. So, so also, you know, to a point that we've been deliberating around, and I will come into Archana from CK Birla Hospitals immediately after this, is that, you know, what is happening today is something that happened long ago in an unstructured fashion. So I'm a third generation doctor in my family, and my grandfather used to practice. And a very interesting thing that I used to see while he used to write his notes were that he would mention the clinical details of a patient, and, you know, at the end, write a small note saying that patient traveling to the US. So I always thought that it was and as a kid, I used to go with him to his clinic and everything. So I would always think that, you know, it's just a random thing that he writes on. But then I realized that every time the patient would come back, my grandfather would open the notes and, you know, would read through it and then close it and say that, how was your US visit? And the patient would feel that, you know, wow, the doctor remembers that I went to the US. So, you know, now what technology is doing to us is giving us that platform where we can actually structure that connect with the patient. And I think that goes a long way in patient experience. So without kind of pitching in any further, let me jump on to Archana Gupta from CK Birla Hospitals. Archana, are you there?
Yes, I'm there. Very much here. Thank you, Saru. Yeah. So you kind of hit on the nail. Patient experience in healthcare. I think Archana also mentioned that it's a long. When I joined it, I was basically a majority of my work experience has been in Taj, and I moved into healthcare some 8 to 9 years ago. And believe me, I joined Manipal some 2013, and thereafter working Fortis before moving to CK Birla. In every hospital group, what I found was patient centricity. They speak about it, but it's not there in the spirit. You know, customer centricity or patient centricity. It's this industry is more skewed towards clinical excellence or doctors. More skewed towards it. It is okay if the patient is waiting for hours together. So what? They're supposed to wait, and that's the norm with every doctor starts. And it was a big a cultural shock. And what I really understood was my journey starts in setting the culture to look at patients also. Of course, doctors are important stakeholders here, but can we also look at, what are the patients or our customers talking about us? And the journey started from listening to customer. Technology helped in collecting the feedback in real-time basis, and without at the not only looking at spot resolution, but also looking at setting the culture of review cadence from the senior leadership to down the line, to really hear what they're asking about, what they're talking about, and which need not be only about clinical outcomes or doctor related interaction or a nurse related interaction. It can be as small and meager as my food was not great or my soup was cold. So bringing the senior leadership to look into that, and there were two-pronged approach which I had done in all the healthcare wherever I worked with. Is one is driving process improvement, especially in non-clinical area. Clinical nursing, I don't have there is a rigor how to train and how to work. In doctors, brilliant innovations have happened. It's a non-clinical part, right from how do they search for a hospital, how do they book an appointment, and how do they come and park and really reach, and not come as a walk-in, but actually, meet the consultant at the right time of appointment, and then have a follow-up system. I mean, I'm really telling you, we're starting with the basics. I mean, the journey started from the basics of how am I able to book an appointment, how am I able to reach and meet, and not throttle the operations by coming at 70% walking. And everyone is complaining, and everyone is stressed out. So the journey started from there, and one is with technology and with normal looking at processes, how we do leap improvements, process improvements, and second is building relationship. So what you spoke about, Saurav, about your dad writing, he went to US, the connect. So what we also we stressed on, we added a layer. Everyone in the system is interacting in a very mechanical fashion, whether be it front office operation guy who is checking in, be it nursing who's always does not have enough time to interact, and created a layer called patient experience team or a customer welfare or a patient welfare, whatever you call it. And their prime role is not just to resolve complaints, it's about to building relationship. Is there somebody, what we found was, is there somebody who's, in other service industry, is very difficult to please a customer. Here in healthcare, all you need to do is give an undivided time and attention. Sit with them, hear them out, whatever they have to blabber. Of course, resolve their solution, resolve whatever the issue their query is. But believe me, the amount of emotional outbursts they would have, amount of connect, just even despite the process gaps, despite the major lapses, they would come back because of that one person there. We created. So these two-pronged approach, with technology making a leap process improvement, for example, like appointment scheduling management, going to pan-India, one number appointment helpline, duty rosters, to discharge tracker, real-time trackers, to know in each unit where is the process stuck, which is another pain area for every healthcare, to feedback collection, to, I mean, what Soumya also spoke about, how do we do connect with them post-discharge? What is the mechanism? Are we sending a relevant communication, or are we just sending them, hi, we are here, how are you? No. Are we giving them relevant, even medication reminders? A lot of, they come back because they do not take medicines on time at home. So is there a mechanism with technology? So technology, and even the last 2 years, it made a leap improvement. As you rightly said, we hit it. The technology hit the healthcare finally. Actually, yes. Before that, we were struggling. Oh, we can't give prescriptions online, and that the laws do not allow us, and all that. I mean, really, patient confidentiality data. A lot of things have been sorted out during this pandemic. Thanks to the pandemic, we've been able to make a move, and people have been bound to adopt. Especially doctors. Doctors are the last ones to adopt the new technology as far as patient is concerned. In innovation, operation, robotic surgery, all they are in for it. But these technology, I've seen a sea change. So yeah, we are on a way forward, and a lot of things are happening in the last 5-6 years with the help of technology. A big change is happening to enhance the patient experience. Thank you, Saurabh.
Excellently put, Archana, and I love the way you put it with that ease and comfort. But you know more than me how much it takes to get doctors to, follow technology and innovation. But that's something that, as an ops head, I always kind of have a major discussion on. And if we specifically talk about patient experience, I always quote a small example where, if we were to divide the experience of a patient into the pre-treatment phase, the surgery phase, and the post-treatment phase, it is actually the surgery phase for which a patient comes to a hospital. And this is a very common discussion I have with every joiner into our hospitals. So, what happens is that the first thing a patient sees when he needs a complex, for example, a complex cardiac surgery, is who's the best doctor. It's a very natural thing. The Indian industry is driven by the doctor. People would search who's the best guy in the city and want to go to the best guy. The second question that a patient would ask himself or herself about while making a decision on which hospital to go is, which is the best hospital. Now, the best doctor clearly comes with the concept of having the best skill, having the best outcomes, etc., so on and so forth. But how do we define the best hospital? We come from different hospitals in the industry, and we all kind of, have our own niche spaces. But how do you define the best hospital? And that is where the patient experience comes in. So I always give this example to my teams that when a patient comes in for a surgery, the patient is coming in for stage 2, which is the surgery inside the OT. But when he comes into the hospital and doesn't find a parking slot, it's a problem. When the front office guy doesn't handle him with care, it's a problem. When the nurse gives multiple pricks while putting a cannula, it's a problem. All of these pre-treatment problems, patients many a times engulf and say that, chalo, surgery ke liye gaye hain, we have the best doctor, let's just have it and let's get the surgery and, we'll be done, forget about it. Then comes the stage 2, which is the actual phase where the patient came to the hospital, which is the surgery. Unfortunately, in this phase, the patient is anesthetized. The attendants are outside the OT and are dependent on whatever information the hospital and the doctors are passing on. So technically, the patient doesn't experience the actual phase of why he or she has come to the hospital. And then comes the post-operative phase where, again, the GDAs are not coming, the housekeeping is not cleaning the washrooms, and all of those things happen. So the point is that if we look at this objectively, and this is a very interesting discussion I have with my doctors, that if you actually look objectively at the experience, it is actually the first and the third phase which is creating that experience, and not the real core reason of why the patient came to the hospital. And that's where the patient experience piece comes in, and we need to kind of redevelop and rejig our strategies. So I would just open it for some time to anybody who would want to kind of comment on the role of technology in shaping patient experience.
Yeah, I can take that. To that extent, I didn't think the other. You want the attendees also to prompt on that?
I think we'll take questions from them as per process.
Sure.
We can just have a couple of comments from our respective domains at this point.
Sure.
So
Yeah.
I'll take it, Archana again. So technology definitely played a big role. As you rightly said, healthcare has been shining away from technology. And when you look at other service industries, we have 24/7 ATM, and we still tell people to come to for consultation only from this time to this time. We're not even there. We're really not even there. And we every time we ask them, I mean, most of the hospitals I see, the EMR is also not robust, where the patients are asked to bring their previous prescriptions, and they are supposed to remember when to come for follow-ups and all that. Now things are changing, where automated reminders are given for their next consultation, or as Soumya mentioned, that relevant communication are being sent. Okay, this is now 30 days have passed, you're supposed to do this, and now your LMS, your whatever vitals are looking this. There is a tracker, and miles to go, but there has been a big change, sea change from last, I think, in just last 1 decade, or maybe a lot of changes have happened in just in fact, in the last 2 years or so. So I'm sure even in motherhood, there are a lot of technology-based interventions to remind the user, the provider, the caregiver, when to intervene and when to call them. Okay, this is your time to come for your follow-up, and those simple things really matter. And I can now leave it to Archana Sangam, my namesake, to also kind of give in her input for technology.
Yeah, while we spoke about a lot of them, two things that I am happy in terms of the technology interventions that we did in the last 2 years is one, my insurance processing, right? While the patient is, my guest is getting discharged, was something which was a real pain area. And here it was not just one-sided, it was three-sided. There was a TPA in between, there is the final insurance at the end. So the way technology helped all three of us to integrate, while this is still in the happening, not all have completely shaken hands together, but few of these TPAs, few of these insurance companies really moved fast and we integrated towards on basic platforms, even though if it's not a high-end tech platform and all, but basic platforms of sharing documentation, quicker responses, quicker query, sharing back the queries and we giving back those clarifications. They also communicating back to my guest saying that they are also processing it so that the guest is not just upset with me, right? If there is a little more time taken, right? That is one real change that has impacted us in a good manner, where my guests are, while they're waiting to get discharged. So what happens is the moment the doctor says that, yes, you are good to go home is when their clock starts, right? And from that moment, the next 1 hour, they want to go home. But while there is an entire process of 3 to 4 hours, which was taking in terms of getting that entire insurance clearance and the payment to be done and things like that, which has now cut down drastically. And those regular communications from both ends is keeping their anxiety levels low. And that has made a big change. That's one. The second, another major technology impact that has happened is WhatsApp. To be honestly, after the death of SMS in an absolute manner, we were really stuck in terms of how do we be in the top of mind of my customers? How do we communicate? While they are also killing us with the costs, but yeah, the impact is immense. So every communication with a visual impact going on, especially to my segment where that visual creatives give a lot of happiness. There is a lot of empathy. There is a lot of connect that I can make through those creatives and images rather than just by texts. So even an alert that they're due for a scan, even an alert that their baby is due for a vaccination, which is going through these creative-based WhatsApp communications, has immensely impacted in terms of retentions, right? So these two are something which we are very happy because it's not just the engagement, it's not just the service, but my team is also impacting the business.
No, I have mixed feelings to say that it took a pandemic for us to realize that technology is valuable. But okay, so
that was an intervention, Saurabh. That was required.
So before I kind of move on and probably open up a new question for Soumya and probably Bhavna, the rightful people to answer that, I also want to kind of share some light on patient expectation setting, because a lot of times in our hospitals, our teams fail to figure out where that thin red line is. And patients would come with expectations, which is true, but then many a times the expectations go beyond what is part of the scope of the healthcare services. And I think that's extremely important. And it reminds me of a very interesting example again of a patient who came in for a very complicated neurosurgery, refused by many hospitals in the city, landed up at our hospital, and we operated. And fortunately, we saved the patient. So because it was a high risk patient and, a little bit in the newspapers here and there, so we met the patient and asked him, how do you feel about it? So the patient said, Doctor Saab, sab kuch acha hai, aapke doctors bahut achhe hain, the hospital is the best hospital I've ever seen in my life, but ek bahut major problem hai. And we were kind of taken aback. We said, "Bataiye sir, kya problem hai?" He said, "Aapke yahan custard bahut thanda hota hai, daant mein lagta hai." So this is a moment where you would say that you would not be sitting there to eat that custard, but So, having said that, I think, that's where we took a step back and realized that, these are small little things which add to the entire experience of a patient. And we actually revamped our entire F&B services by a couple of such small little feedbacks. So the point that I'm trying to make here is that, along with patient expectation setting, we should also use these as, those positive feedbacks to go back and make changes in the system. And these precision based feedbacks are things which, make any organization richer in terms of culture and perspective. So with that, let me just move on to Soumya, and probably Bhavna can pitch in on what do you think are the best strategies that we should be adopting for creating a patient-centered approach.
So we've been thinking about it. I mean, we've been doing bits and parts, and then we created this platform, and which sort of ties up the patient life cycle journey. But when we did it, we figured out that we had built it for for enabling hospitals or healthcare institutions do more managed interventions and have the single view of the patient across, right where you said, like when he steps in for the first time, pre-surgery, through surgery, post-surgery, right? So looking at from the hospital standpoint or the healthcare institute standpoint, so we developed that platform, and we've started to, onboard healthcare institutions on it. But while we did that, we also realized that we needed to create something for the patient also. So again, Archana has been prodding us for some time, and then we looked at other use cases also, and we felt that, and again, we're looking at this coming in from conditions which are long term, where there is sustained requirement. And I'm hoping there are no doctors on this panel, I mean, pure doctors, because one of the things that we're trying to cut through is, as also been mentioned earlier, is that we are trying to figure out how a patient connects with the institution and not a doctor.
Yeah, I am
And
a clinician by background, by the way.
Okay. Because I think what, and I think somebody rightly said before, I think Archana Gupta mentioned this before, that there's a huge dependency, or there's huge branding that happens with doctors, rather than institutions. So patients connect with doctors, and the doctors keep moving from one institution to another. I personally, again, through my dad, had all this experience. We had a best cardiologist who moved from one hospital to another, and my dad kept going to different hospitals as he started to get treated. I think that's not a great practice, because doctors are a function of the environment. They don't control or influence the environment that much. And I think that creates disruption, in a long-term ailment situation, where there's a knee surgery that's happened and you have to really work on it for a couple of years, or as is it cardiac, or anything related to oncology or things like that. So I think what we're trying to do is to create a patient app where the patient can get connected to the healthcare management system that we built. And we're trying to do a 360-degree engagement in terms of based on the ailment, trying to see how patient can do exercises, diet chart, diagnostics, and at each point of time, throw that back to the hospital. So if your blood pressure has gone up to a certain level, then there should be an alert set up where a nurse can call out and chat, and then maybe fix up an appointment with your cardiologist, and then do a video call to understand the symptoms. So have a patient app. I think that's one thing that we're trying to do, and through that also engineer a more a connect that is between the patient and the healthcare institution. Obviously, where doctors play a key role, but it's not centered to doctors alone, because we believe that the environment can do better, with the patient. I mean, the healthcare institution has much more, I think, wherewithal to take care or basically deliver this, and not make it very, because the moment you keep it a doctor patient, you are still relying on that human intervention, and you still are sort of breaking processes. So one of the technology key areas is that focus to bring that on the table. Yeah.
So Saurabh, I can step in. I think if you're talking about strategy, I think there are two factors that I would look at it. One, basically, strategy is not only through a technology, it is a business plus technology coming together, right? So there is business intervention and then there is a technology enablement part of it. Number two, the strategy also depends upon the maturity of the institution or the organization, right? There are certain healthcare organizations that are way ahead in the maturity curve from a technology adoption standpoint, and there could be some organizations which are somewhere in between, and the others may be in the path or in that journey somewhere, right? We have seen the shift from all angles, at least being in the technology organization which caters to that wide spectrum. We have seen that. I can take some examples when we are talking, and Saurabh, I really liked your analogy of like during and post. We typically use that in retail world or in a travel and a hospitality world, right? Like
So
pre-travel.
that's what I utilized when Soumya was abusing me as a clinician. So
So I think, and that also now, because customers or patients who are also consumers in a different industry, carrying that expectation and behavioral pattern into the healthcare industry also, because their behavior is tuned in that manner, right? During the shopping or pre-travel, these are my expectations. I expect the brand to interact with me in this manner, and during shopping or at the airport, I expect brands to communicate. So that behavior is something psychologically we as, I mean, I'm putting myself also, because we all experience the same thing, right? They bring in that. So the strategy, when any organization is designing a strategy from a patient experience standpoint or a guest experience standpoint, it should start from where the journey starts, right? So I see a lot of organizations, at least healthcare organizations, which are somewhere in the middle level of maturity, are redesigning their entire business model itself to keep patient in the center and starting from that, right? And some organizations are looking at, like, I can give you an example. One of the largest hospital chains in India they've already advanced it. They've collected a lot of patient data over the years, right? And they've built, this is specific to cardiac risk score prediction. So there are AI CVD models that has been already built. Now after that, right? This is specific to the organization, but how does it matter to a patient? So what we are doing working with that organization is that leveraging the HoloLens, AR, VR technologies to kind of visualize the risk score and put it on the patient, to actually see what it means having a risk score of XYZ to his health, right? This actually makes them realize a bit more of what is the risk. If someone prescribes it on a piece of prescription, they really don't know what it means, what is that value means, right? So this basically is showing like, okay, currently you're at this risk score, your heart is looking like this. If you continue, this is what it is going to be reflecting as. So that actually makes, it may have both pros and cons of it, but actually, we as humans, we believe in what we see, right? So that's the kind of an advancement we are going. And number two, that I was also making a note when both the Archanas were talking about, is the patient engagement by the clinician at the hospital, right? Many a times the doctor doesn't even look into the eyes of the patient. Yes, the patient is talking and the doctor is scribbling on the notes, right? That also makes us feel not engaged. I think end of the day, we are all humans. We need that eye-to-eye contact. So there are technologies which some of the organizations are adopting, speech to text. So when the doctor is speaking, he is actually on a continuous mode engaging with the patient. The automatic speech to text is recording the entire conversation and then automatically comes out with a prescription as an electronic record, or if the patient wants it as a print record, it comes. So that every time they come, they don't need to bring their prescriptions, their physical records and all, right? So that is again another experience, interventions. Again, the point I'm conveying here is, depending upon the maturity of the healthcare organizations, the technology interventions or the technology enablements are changing. But on a whole, if I have to say, everybody is in that digital transformation path, keeping that patient in the center. I think that mind shift or the industry shift has started, and I'm sure that is going to go on for long, and everybody's focus is going to be towards how do you engage customer at every touch point. And I shouldn't be saying this, but the mindset that today's world is looking at is healthcare industry is also looking at giving those retail experiences to the patients who walk in, right? Like, as you enter into the hospital, you are greeted, or your patient record is available at the front reception. Your records, you don't need to go to 10 different places. You have a sequence of events. Can go here, collect this report here at so and so time. So it's not just only saving time for the patient at the hospital, but also the whole cost of care also is coming down. I can give one example with Max itself, where we have done again a HoloLens virtual care. We not necessarily all the specialists are at all locations, right? So a patient has to wait for that specialist availability to their time, their availability, their travel cost from wherever they're located. So to kind of make a principle for many organizations follow, making health reachable to a larger population, right? Affordable, make health affordable. So this virtual assist is something that the specialist may be sitting anywhere in the world. He's assisting through the HoloLens with the surgeon who is actually in the OT and successfully delivered that surgery in 2 different organizations, and Max is one of the such organizations. So experiences again depends upon the expectations of the patients, but I think it's important to start smaller and set the right expectations as we go. That's at least my 2 cents based on my experience in Microsoft the last 2 years, working very closely with different segments of healthcare customers.
Yeah, you're right. Actually, I mean, I've been fortunate to be on the roller coaster that's ahead of the curve on technology. But in my so many years of running hospitals, I think I'll make 2 closing comments. I think one thing that I have learned is that we started off as an industry where we went out and tried to tell the doctor and the patient to, fall in line with the rules of technology. So we told the doctor that you have to type an e-prescription, you have to, the patient is we tried to change the behaviors of patients, where we said that no, you just keep looking at the screen, and when you see your number, that is when you get into the cabin. My learning in all of these years has been that everything that we do from an IT customization in healthcare doesn't really mean customizing healthcare to IT, but it means the other way around. We need to customize IT to healthcare. And with that analogy, it should be as close to the conventional model as possible. If we're talking of a virtual consult, when we do a normal consult, there's a waiting lounge outside the doctor's chamber where the patients are sitting, and the doctor knows that I have 5 more patients to see, and hence he kind of factors his time accordingly. But in a virtual consult, we don't have that. So I think the attempt has to be to recreate the offline model into the online space in a way where the behaviors change to the minimum, and that is the only way adoption is going to happen in healthcare. The second comment, and I will kind of hand it over back to UBS forums after this, is I am a very firm believer of the fact that if there is something good or there is a best practice happening in any other industry, it should be shamelessly copied. And pardon my French, I use that word because cross learnings is something that healthcare has never learned. As healthcare professionals, we grew up with the model that, what, we are the cream of society. How can we learn from someone? People have to learn from us. We are the healers, and so on and so forth. I think that is where we've lost out on a lot of opportunities for cross learning from other industries, which are now, way ahead of us, especially if we talk about the process excellence space. I think Archana spoke about operational excellence that they are doing at CK Birla hospitals. So, we should, blatantly look at the hospitality industry, the airlines industry, and any best practice that we can actually pick up and customize for healthcare is something that we are doing today and we should do today. That's the way forward. Thank you so much. That's all from me. If there is a comment from anybody, I'll be happy to take it. Otherwise, we can have the UBS
No.
forum team come in.
I completely echo with Saurav and all. Whenever even I being in Bangalore had worked with a lot of technology startups, and the first thing that I always needed to work with them is make it user friendly. From operational side, are they able to use it, and is the end customer getting it? Make it user friendly, healthcare friendly. And the second stage, sort of, which I also found was struggling, with, as she rightly said, Bhavna, that maturity of the organization. We have a lot of innovation in the technology front. Is the organization ready to embrace it all? You know, we worked on a beautiful discharge real-time tracker, and the organization felt just by the technology adoption, we should get a improvement in the a reduction in the complaints. Somebody has to look at the insights coming out of it and make changes process. So adoption by the leadership, by looking into it, is also depending on the maturity. Bit by bite, it only kind of progresses. Thank you.
Great. I think it was a great conversation. I had good fun understanding the different. I mean, obviously, it's an area of interest for sure, but I had great fun understanding and listening to what all is going on in the industry. And I think I'm glad that we are all on the same page from a growth perspective and from a trajectory perspective. And we are at a stage where I'm looking more from a industry growth than organizations growth, and that's what we need as a country today. So anyways, thank you so much for spending time with us, and it was a fantastic conversation. Thank you so much for having me as your moderator, and we should keep in touch after this.
Sure.
Thank you.
Sure. Thank you so much.
Thanks, Archana.
Thanks, everybody.
Thank you.
Thanks,
Bhavna.
Thank you all.
Thanks,
Bye.
Saurav. Bye.
Thank you.
Bye.
Thank you
guys
so
take
much,
care. Have
Saurav,
a
for
good weekend.
beautifully moderating it. And thank you so much, all the panel speakers, Archana Sangam, Archana Gupta, Bhavna, Soumya, all for joining in today and sharing your best
Thanks.
insights. And thank you so much, all the attendees. Stay healthy, stay safe. And in case you have any questions, please feel free to write back to us, and we'll be happy to connect you with Easyrewardz and Microsoft directly. With this,
Thank
we
you
will
so
Thank you.
much.
close the session for
Bye.
the
Thank you.
day.
Thank you, guys.
Bye.
So much,
Bye.
all of
Have a
you.
good weekend.
Thank you.
Bye.
Thank you.